The meeting will begin shortly.
Good morning, everyone. I think it's 11 o'clock. I'd like to welcome all the retirees that are joining our meeting today and say Happy New Year to those of you who I haven't seen this year or maybe in a long time. Thank you for joining us. Today, we're going to talk about health insurance, as you know, and the Human Resources Department certainly recognizes and knows the importance of health insurance to employees and especially retirees and even our applicants. So that's one reason we want to take some time and invite all of our retirees, if they wanted to participate in a meeting like this, to get information, ask questions, and provide us input. County Administrator Brown, who I think is either on the call or maybe on the call later with us, informed the committee that we formed called the I.M.P.A.C.T Committee to talk about health insurance at the first meeting that our current amount that we spent on health insurance was not sustainable from a financial standpoint when he attended the first meeting. So in summary, that's mainly what we're going to be talking about today, the county's current plan, financial status, and give you some ideas, options, and thoughts the county is considering. We know this is health insurance is very complex and it's a lot of information. We're going to try to keep it as user-friendly as we can. Last year with the I.M.P.A.C.T Committee, we had about 7 meetings and they're about 2 hours each. So, I mean, that's 14 hours. So we're not going to try to go over all that. So just try to hit on some high points from those meetings. We have made all that information available or accessible if you'd like to look at it. The meetings were videotaped, so you can even listen to the meetings, watch the meetings if you would like to do so. Over the years, one of the things that we've been told by all the insurance companies that we've been with, it's been the Carolina Care Plan, Aetna, Coventry, Blue Cross Blue Shield, and Cigna, that the county has a very rich health plan. And when they use the word rich, they mean specifically it was better than the insurance plan that each of these insurance companies provided for their employees. And that's, again, not just my opinion. That's something each of them told us separately while we were doing business with them. We have a lot of employees and retirees who have chronic illnesses, and that drives the claims up. That's one reason that we have a lot of claims, and claims equals insurance. Sort of like if you have a car and you have accidents or speeding tickets, then the rates go up. It's that same analogy. Currently, the county has employee health insurance with Cigna. We have our early retirees, and when I say early retirees, those that are not 65 are on our Cigna plan as well. And those that have Medicare Part A and Part B are on the Humana plan. And if any of you have been on the Humana plan for probably 7, maybe 8 years, you remember we had some meetings when we changed from when Blue Cross Blue Shield got out of the Medicare Advantage group business. We had to change and we went to Humana. We're not here to announce any change today. That's not the meeting, but the purpose of the meeting, but I think you remember us having those meetings. The presentation today is going to be done jointly by the Human Resources Department and HR. I certainly would like to thank the retirees that were members or participated on the I.M.P.A.C.T committee. Many retirees did. I think at least about 14 or 15 did from memory. They were very engaged in giving their input and opinion during these meetings, and we thank them for that. Also, would like to thank our IT department for helping us put the meeting on in this fashion. Hopefully it's safe. We would obviously have liked to have the meetings face-to-face like we did when we switched from Blue Cross to Humana many years ago, but for everyone's safety, we're doing it via Zoom. Miss Angela Weathersby has been extremely helpful, and we certainly of the IT department give her a personal thanks and a shout out for being so helpful. Lastly, I'd just like to say before I turn it over to Ms. Trina Walker is that I certainly want to recognize and appreciate County Administrator Brown for not only providing us this opportunity that we can share information, listen to questions, get input from retirees, but advocating that we do this. This is not something that we had to request of Mr. Brown. This is something when we were meeting with him last year, he said that this is the way he wanted to do things, and it was important to him to have input from employees and retirees prior to making a decision. So I certainly think that's a very good approach. I think from an HR standpoint, to get input on the front side versus changing something and then hearing about it afterwards. So I certainly would like to recognize and acknowledge that that is something that he has not only supported, but promoted and been very engaged in. He has been on all the meetings that we've had with employees earlier this week, and also attending the I.M.P.A.C.T meeting, the kickoff I.M.P.A.C.T meeting. And I won't be introducing her, so I will also mention Ms. Lori Thomas, who is an assistant county administrator who, if I'm not mistaken, attended every one of our I.M.P.A.C.T, all 7 of them, our I.M.P.A.C.T committee meetings, and has also been very active and engaged in this process and attended both of our employee meetings as well. So I won't be introducing her, but you'll be hearing from her later. So I just wanted to acknowledge that. So thank you all for being a part of it. I will turn it over to Ms. Trina Walker, who will do the first part of the presentation. Thank you.
Thank you, Mr. Hanna. Good morning, everyone. Again, thank you all so much for joining us on this Friday morning to share a little over an hour probably with us to go over health insurance information. Again, I am Trina Walker. I am one of the team members here in the HR department. We do want you all to know that today's meeting is being recorded, so it will be available to you all in a link that we have provided and will provide to you again so that you can access this recording as well as other information pertaining to this project. Okay. Today's agenda, of course, thank you, Mr. Hanna, for the welcome. We will be sharing some information with you regarding our Cigna plans, the state of the county's health insurance, and Humana with you. And then we're going to open up the floor for your questions and comments, which is the ultimate reason for today's meeting. We are going to ask that you hold your questions and comments until that time, and this will give us the opportunity to cover the material that we have presented so that you will have all the information as you prepare your questions and comments. Okay, so as Mr. Hanna shared, the Project I.M.P.A.C.T started with the creation of a committee. We partnered with, department directors and elected and appointed officials who identified individuals in their office to serve on the committee. We also invited retirees by sending a letter to home addresses, inviting them to also be a part of this committee. The committee included 25 active employee committee members, 15 retirees, and this all these persons made up a total of 18 different departments represented on the committee. And again, the committee members met for 7 consecutive meetings. Our meeting topics that were shared started with an overview from our county leadership, and then we started into the basics of benefits, which was the ABCs of benefits, and then we had a presentation by Gallagher, then by Cigna, then by Humana. And then our meeting 6 included cost containment strategies that we shared amongst the group. Again, this presentation is only a small fraction of the information that was shared during these committee meetings. All of our committee meetings recordings, notes, all of that information is available on the site that I was speaking of earlier that you all have access to be able to view if you want to review that information. All right, we're going to first start with the survey results. The Human Resource Services Department received 450 responses to our survey. 396 persons identified themselves as employees, 39 persons identified themselves as retirees, and 15 persons provided no response to the question. There were 29 of our 33 departments that participated in this particular survey. For those who responded to the years that they have been with Richland County government, about 25% of our respondents were those employees who have been with the county for 0 to 5 years. And then, of course, by age bracket, you can see, by years bracket, you can see the number of employees and retirees that provide responses based on their years of service. Okay, so the survey in itself consisted of 23 questions. So we're not going to spend a lot of time today on every individual question that was asked. Again, this survey and the results will be provided on the link in its entirety for your view at your leisure. During this presentation, I will only be going over a couple of them just so you can get kind of idea of who responded and somewhat of the census of those who responded and what their responses were. Question 2, if currently enrolled, which health plan are you enrolled in? 71 of our employees, because only the choice plan is offered to our employees, 71 of our employees are currently enrolled in our choice plan. Our standard and our buy-up plan are offered to both employees and retirees. 166 are on our standard plan, 180 on our buy-up plan, 16 on Humana, which is our Medicare Advantage plan, 10 waived coverage, and 7 provided no response to the question. For question 3, if currently enrolled, which tier of coverage do you have? There were 284 retiree only or employee only, 30 that have spouse on their coverage, 86 that has children on their coverage, or 32 that has family coverage. And there was 18 that provided no response to this question. All right, question 6. I am satisfied with Richland County's health insurance offerings. There were 105 that strongly agreed, 239 that agreed, 76 that disagreed, and 26 that strongly disagreed. And then there were 4 that provided no response to the question. Question 8. Richland County government's health insurance costs are not expensive, reasonable, or too expensive. There were 55 that said not expensive, 292 that said reasonable, and 100 that said too expensive. There were 3 that provided no response to the question. Question 10, do you think employees and retirees should pay more if they have 2 or more children on health insurance? Basically, you're paying per child. There were 184 that said yes. There were 248 that said no, and there were 18 that provided no response to the question. Question 16. This question was directed to retirees only. What is your opinion of Richland County's current retiree health insurance plan? There were 17 that said very favorable, 41 that said favorable, 18 that said not favorable, 45 that don't know, and 329 that did not provide a response. And question 20. I have an opportunity to elect health insurance coverage under someone else, but choose Richland County government plan. There were 59 that stated yes, 340 that said no, and 51 that provided no response to the question. Questions 21 through 23 were all open-ended questions. And so all of these responses have been captured and will be available for employees to view. Additionally, the unedited survey responses will be provided to County Administrator Brown and Assistant Account Administrator Lori Thomas. So in our comparison of our plan to other entities, we looked at a number of other entities to compare our coverage with. We compared our coverage with Lexington County, Mecklenburg County, and the city of Charlotte as examples. Overall, the comparison shows that our plans are rich and reasonably priced as it relates to other entities. Additionally, we also compared our plan with South Carolina P.A.C.T. Oftentimes, you all know this as the state health insurance plan. This is the largest plan in South Carolina, covering 268,000 employees, and these employees are employees of the state, higher education, and school districts. 34 of our 46 counties, cities, and towns are included with the P.A.C.T. plan, and this also includes the city of Columbia. Oftentimes, we have retirees to ask us if we have went out to market to compare our plans and our prices with other entities. And we just wanted to provide some historical information as how many times we've gone out for a RFP, which is known as the request for proposal, and external market reviews. We wanted you all to know that in 2001, 2003, 8, 11, 14, 17, 19, and 2021, we went out to market to compare our plan and prices with other plans and prices in the market to ensure that we were offering quality coverage to our employees. Additionally, we wanted to share our carrier history, as most of you may not be aware of how many vendors or carriers we've been with over the years. From 2008 and prior, we were with Carolina Care Plan. 2009 to 2011, we were with Blue Cross and Blue Shield of South Carolina. 2011 to 13, we were with WellPath. 2013 to 14, we were with Coventry, and our relationship with Cigna started in 2014 to current. Additionally, we thought it would be helpful to explain to our retirees how premiums are determined. Again, the premiums are what our carriers charge us for coverage. There are a number of things that are considered when underwriters for these companies prepare to quote the premiums to companies. They consider the number of employees, dependents, and retirees that will be covered on the plan. Additionally, they consider the average age of employees and retirees. When the average age of employees and retirees are higher, underwriters anticipate more care and services will be needed, okay? Additionally, they consider the plan experience and utilization. This includes the claim history, which is, of course, how many claims are filed against our account, and the medical loss ratio. Now, the medical loss ratio is the percentage of premium dollars paid and the claims dollars, the percentage of dollars collected to the claim dollars paid. So that is what we pay to the vendor and the amount that the vendor pays towards our claims. Last year for Cigna, Richland County's medical loss ratio was 100.7%. This means that Richland County spent more than the premium dollars paid. This is the data for Cigna. For those of our retirees who are on Cigna, this is the data. So to date with Cigna, Richland County's claims are $9.7 million more than the premiums paid to Cigna. This is our cumulative loss with them, $9.7 million more than the premiums paid. Additionally, underwriters consider the benefits and services built in our plans. So of course, with any services and purchases that you make, the more you add, the higher the cost. We had some persons who mentioned in the survey about adding bariatric surgery to our plans. We're just using this as an example. To add this particular service to our plan, Cigna estimated that there would be an approximate 5 to 7% increase in our rates if we were to add this surgery to our plan. This would be an increase of approximately $1.2 to $1.7 million more than our current premium. Additionally, underwriters consider the administrative costs to manage our plans. This is also considered in our premium costs. Based on the current data, it is highly likely that our current plans without modifications would require premium increases for 2023. That's just based on the data as of today. All right, regarding our data with Cigna, this is only for those who are on the Cigna plan. Cigna provided us some data as they are the ones that holds our claim information. Based on our health conditions and top cost drivers, Cigna has provided us that 50% of our members have chronic conditions. Conditions are those conditions that require treatment every month. All right. This population of members are driving 83% of our total spend. 50% of our members have chronic conditions, and they are driving 83% of our total spend. They provided that hypertension, obesity, metabolic and immune disorders, diabetes, and psychiatric conditions are our top conditions driving our cost drivers, all right? Health engagement. Cigna also provided that 53% of our members are engaged in their health in some fashion. 43% of our members get their preventative care exams. Of the 53% members, 70% are those persons with chronic conditions. All right. Regarding our pharmacy information with Cigna. Now, Richland County Government Pharmacy is above the norm. Typically, chronic conditions are treated with medications. So because 50% of our members have chronic conditions, it is not by surprise that our pharmacy spend is higher, all right, than the average. When you're looking at the first table to the left, based on the 4 different areas provided by Cigna, you can see that our trend is up in all of those areas. Overall, prescription trend has increased 16.2%. In the middle section, by spend, you will see the top therapeutic classes and the associated conditions in most cases, and the trends for those as well. As you can see to the far right corner of that middle graph, that you will see that the different trend percentages by the therapeutic class. On the far right, our medication adherence. Based on the condition, the hypertension and the depression, our Richland County population is below the norm as it relates to medication adherence. Regarding diabetes, we are actually above the norm with 74% adhering to medication advice from their primary care doctors and physicians. And then cholesterol, we're right level with the norm at 76% for cholesterol. Regarding the Cigna data, we kind of wanted to give a picture of our information as it relates to active employees compared to our retirees. So this current slide is relating to the data of only active employees, okay? The medical trend for active employees have increased 13.8%. The pharmacy trend has increased 20.1%. The overall total trend has an increase of 15.2%. Employees represent 65% of our total population and 80% of the spend. Employees incurred 21% higher costs than their spouses. And again, Cigna provided the top conditions by spend, you see those 4 listed, and the top drugs by volume for our active employees. The current medical loss ratio for our active employees only is 84%. Now, regarding our retirees that is on our health plan for Cigna, the medical trend increased by 10.1%. The pharmacy trend actually decreased by 7.8%, and the total trend for our retiree plan increased by 3.4%. And again, Cigna provided the top conditions by spend and the top drugs by volume for our retirees. The medical loss ratio for our retirees only is 137 for the medical loss ratio for retirees only. All right, so that was the information pertaining to Cigna. Now we wanted to share, because we know we have those who may be on our Humana plan, some data regarding Humana. Humana provided the data comparing our 2021 benefits year to our 2020 benefits year. As you can see, of course, 2020 was the year that COVID came on the scene, so it's not by surprise that our current year is a little higher than the prior year, which is 2020. So the current year is 2021, and the prior year is 2020. Of course, during 2020, a lot of people probably were not going to the doctor and getting their normal visits in due to COVID. So it's not by surprise that those numbers are a little higher when you're comparing those two with the data provided by Humana. Additionally, Humana provided that our large claimant data, the top conditions by spend, the first were diseases of the circulatory system. The second was those of the musculoskeletal system. And the third one was our preventative services. Now, number 3 is definitely not a bad thing. We want our retirees and family members to get their preventative care services. So that's actually a good thing that preventative services are in our top conditions of spend. All right, and then to the right, you will see those conditions, those top conditions by prevalence. And you see our top 5. All right. Additionally, Humana provided this information to us. The main thing I want to point out in this particular slide is this particular row right here, the net paid per member per month. As you can see that the prior year, which is the 2020, there was an increase compared to the current year of 2021. And again, that's not by surprise due to COVID coming on the scene in 2020. They did also share that 95.7% of our prescriptions are in Tier 1 and Tier 2. Again, Tier 1 is our generic line of prescriptions, and Tier 2 is our preferred brand. The average plan payment per generic prescription is $10.53. However, for brand, it's $633.10. So there is a huge difference in between the tiers. Additionally, they provided the average cost comparing the two years. Of course, the current year is considered to be 2021, and the prior year is considered 2020. And then you will see the difference by types of service, office visits, inpatient care, outpatient care, emergency room, et cetera, comparing the 2 years. The good thing that you can see is that Richland County is not spending a lot of money on urgent room and urgent care services. That is a good thing. However, you can see that a lot of our spend is in the pharmacy area. Okay, now I'm going to share the floor with Assistant County Administrator, Ms. Lori Thomas, who will cover the second part of the presentation.
Thank you, Trina. I appreciate that. And thank you, everyone, for allowing me to participate this morning. During our impact meetings, as Dwight said, we spent about 14 hours together, and we talked about a lot of cost containment strategies, some of which overlap. And the reason that we did this was because our costs and our return for our carriers was so high that to be able to maintain affordable insurance, some kind of a modification may be necessary. We talked about benefits, inclusions, and exclusions. So things that we might be able to modify, take out of, or what it would look like if we added certain features to our plan. We talked about co-payments and what increasing co-pays might look like. We talked about co-insurance, and that's the difference after you meet your deductible, which is whether it's an 80-20 or a 70-30. Currently, our buy-up plan for our active employees, and keep in mind, this is pretty much, I'm talking about those employees that are covered by Cigna. The buy-up plan has an 80-20 coverage rate and a $500 deductible. The standard plan has a $1,000 deductible and only a 70-30 split on major medical. So that can be a big cost driver until you reach your out-of-pocket maximum. We talked about high deductible health plans, or what is called consumer-directed health plans, which is similar to our choice plan that we have here at the county for pre-65 retirees and active employees. We talked about cost share. Basically, that means distribution of premiums and how we may be able to drive some other changes there. We talked about deductibles. As I said, our buy-up plan has a deductible of $500, and our current plan, standard plan, has a $1,000 deductible. Dependent verifications. This is sometimes called dependent audits. This is where we make sure that everyone that's covered as a dependent on your plan is an eligible dependent, which means that you are legally have responsibility for their care. We also discussed funding types. Currently, our Cigna plan is a fully insured plan, which means we pay Cigna, and no matter what our costs, they pay it, as opposed to a self-funded plan, which would mean that we pay an administrator like a Blue Cross or a Cigna to manage our plan, and then the county would pay the premiums. We know that currently that would be a difficult ask because we know that the costs currently are more than what we're paying in premiums. So that would be an increased cost with our current demographics and employee population. One big discussion point came up with the on-site wellness clinic. This has been something that's been successful in many places. It's not a silver bullet that can correct things overnight, but it is an option for employees to be able to seek care without having to pay copays or deductibles. But to do that, we would have to find the funding source. Estimates in first year, I believe, would be somewhere in the range of $1.8 to $2 million to start one. However, it would provide access for care without having to seek it through a PCP or some other type of carrier. Increasing out-of-pocket maximums is always a way to look at managing costs, but we want to be cautious with those to make sure that we hit our sweet spot. Premiums, as I said, this would be that you pay by participant. As you saw in the survey, this was not a very popular opinion of employees when it came to children, but employees also did not believe that were not inclined to subsidize employees to cover their spouses. Prescription drug benefits. We actually have two different prescription drug benefits within our Cigna plans. Our buy-up plan has a preferred drug plan over the standard plan, which has a different list of tier 1, tier 2, and tier 3 drugs. So you would see a difference there. That's a possibility for further evaluation. And additionally, step therapy through prescription drugs, where rather than going immediately to a brand or a tier 3 type of a scenario, that you would benefit perhaps from trying a tier 1 drug or a combination of tier 1 drugs. This is quite common in the market. Retiree coverage and eligibility came up. Not saying we're making any changes in this area. It was just a conversation. Spousal surcharge. Currently, we can enroll our spouses on our employee benefits plan or health insurance plan, even if they have access to coverage at their own employer or somewhere else. Many employers currently charge a surcharge to employees to be able to cover their spouse if they have access to care somewhere else. Telehealth and telemedicine is certainly a new and evolving method of care, and perhaps focusing more on this. I know that through our Cigna plans, we do have access to telehealth, but there is a cost for that. A tobacco surcharge, which in our survey was supported by our employees. Tobacco surcharges are quite common in the marketplace. So employees or their dependents, or any dependent who does use tobacco, not just cigarettes, but also chewing tobacco, those kinds of things, would incur a tobacco surcharge. That was something that was discussed. And then our wellness initiatives were discussed. We currently have a wellness program that seems to be very popular. It is participatory, which means you only have to participate in events to be able to receive the credit. One conversation sort of was centered around whether an outcomes-based program might benefit us to actually be able to drive our spend down by increasing healthy habits. You can go to the next slide, please. As all of you know from the information that's been shared, back in May and June, we actually did a deep dive into health insurance and actually went out and asked for carriers to submit benefits. And again, this is not related to our Humana plan. This is only related to those employees and retirees that are covered by our Cigna plan. We asked that our third party, which was Gallagher at the time, reach out to all carriers that would be available in the area to cover us on either a fully or self-insured basis to submit a proposal to us. They reached out to Blue Cross Blue Shield, Aetna, United Healthcare, and Cigna. United Healthcare refused to present a proposal. They were not interested in taking on Richland County as a client. And when we compared the rest of the submissions, there was very, very little change in price to get benefits that are somewhat aligned to our current Cigna plan. What this did do, however, was bring Cigna back to the table to basically give us sort of a 1-year no-cost increase to be able to maintain our business. There are some caveats along with that agreement, however, based upon that circle around our loss ratios, and based upon our current loss ratios, that will not be the case in the coming year. We probably will see an increase. So these next slides actually show you the comparison between Cigna and the South Carolina State Health Employees Benefits Program, which is commonly called PIBA. We did reach out to PIBA, and they were willing to actually participate with Richland County as an optional employer, and they provided the same rates to us that they do any other optional employer. So this just gives you an overview of the benefits there and what they are. As you can see, the standard plan, which they don't have a buy-up plan, but the standard plan with PIBA actually has a lower deductible than our current buy-up plan. Now, granted, with our current buy-up plan, you don't have to meet that deductible before you go into co-payments. However, as we began to look at this, the savings here would also allow the county to potentially be able to cover the deductibles and still show a significant savings. Not saying any determination has been made. I'm just saying that these are significant savings. So if you would go through 2 slides, please, to number 28. So these are the costs that are related to Cigna and PIBA costs. I'm only going to speak to active employees right now because each of our retirees has a unique scenario and would have to be costed out individually. On the slide following this, what I will show you is the combined aggregate totals for retirees. So as you notice here, the first group of premiums there are for our buy-up plan, the next is for our standard plan, and the last is for our choice plans. These are the columns to the far left under FY 21-22 premiums. There you see the employee per pay period cost, the employee annual cost, the employee per pay period cost, and the employer annual cost for these types of coverages. To the right of the blue line, you'll actually see the employee's cost per pay period for the state health plan. Again, while they do not have a buy-up plan, their standard plan does have a $490 deductible as opposed to our buy-up plan $500 deductible. And it also has an 80-20 coverage as opposed to our standard plan, which only has a 70-30. To the far right-hand column there is your actual employee savings per year based on these costs. You would see that all but 3 classes of employees would actually save money by switching to the PIBA plan. These are monies that could be placed into an FSA or other type of an account, or actually taken home in the paychecks of our employees. In considering these, what we've also done is to consider the costs that would be incurred to see that none of our active employees would incur an increase in premiums this year, and that would be for the 3 groups that you see in parentheses to the right-hand side. Again, as Trina has pointed out, it is highly unlikely that the premiums that we have currently with Cigna will maintain into the next year, the next benefit year. Next slide, please. So as I told you, it's very difficult on a retiree basis to actually come up with total scenarios. But what I have done with our current retiree enrollees is use the same percentage that is being covered by the county in applying to the percentages that would be associated with any PIBA health plan that would be that may be allowed. In this, you can see that retirees under 65, the cost for those employees would go down for the employee from $234,000 to $52,000 annually. For retirees over 65, there is a potential increase, but not saying that that is something that has been decided. This is just my applying the numbers of the actual coverage to the plan. And this also does not cover the differences between what Humana covers and what the state health retiree plan covers. For active employees would benefit by about $500,000 by paying lower premiums. This is an aggregated maximum. From this, you can also see that we have factored in the possibility of maintaining premiums so that no one would pay more for their premiums for active employees, which would also include those retirees, and then also for deductible assistance to cover the deductible that is required before reaching PPO status. Based upon this, to the far right-hand side, you can see that for the total county contribution currently, even with these allowances, the savings would be about 39% or $8.2 million. And for retirees, it would be a savings of about 21%. In the center column there, under current enrollment, this gives the average cost for the county for current coverage for under 65, over 65, and active employees. As you can see, the county would be paying more for our active retirees or for our over 65 retirees. And then at the bottom is a column called full enrollment. The reason that we put this there is that currently we are not budgeting at full employment for health insurance. And keep in mind, we're only talking about health insurance here. Actual top cost of all benefits is well over $25 million. But if we were to fill every vacant position that the county currently has, we would be looking at a health insurance cost of over $25.4 million, which is basically another $4 million to fund health insurance. However, at full employment in the I.M.P.A.C.T plan, we would be looking at about $15.5 million, which is about a $10 million difference. So under our current scenario, the savings for the county would be about $8.2 million under current enrollment. No decision has been made. These are just numbers that we wanted to look at to see what would be available if we went to this alternative and how those savings could be rolled up into other options for our employees, such as compensation. Next slide, please. Here's the I.M.P.A.C.T design plan. It's very wordy here, and I'm going to ask that each of you read this on your own. We've gone over this in our impact meetings, and like I said, the one thing that you'll notice there is that it does talk about meeting deductibles before office visits, but the county has actually started to look at how we might be able to address that. One other interesting factor there is that drug costs do have a separate out-of-pocket max from their health plan there. However, drugs there do have lower copays. Next slide, please. On this slide, I've tried to put into layman terms some of the things that I found most beneficial for employees for the I.M.P.A.C.T plan, some of the pros and the cons. Not just saying it's pros, but cons as well. First of all, the South Carolina Employee Health Plan is financially sustainable. We do know this simply by the number of people that they cover. Again, there are over 268,000 contracts that they cover, covering all state employees and their dependents, all higher education, all school districts, 34 of 46 counties, and lots of local municipalities and towns. They have significant buying power, so they're able to negotiate the best possible rates for their participants with carriers. They do use the Blue Cross Blue Shield network, so it is very comprehensive. It makes you competitive with other governments for recruiting because that's what most of the governments are participating in. Their cost containment for office visits when you use a patient-centered home. There's a program called Perks, which I'll combine these two bullets. That while yes, there is copays for each doctor's visits, but you have once you reach your deductible, there are ways to eliminate those by going to a patient-centered home, which most doctors in the area participate in. And then there are reduced costs to make it possible to fund other items, such as compensation. I think Mr. Brown will point out shortly, but I'd like to not steal his thunder, but do point out that the whole point of this exercise was to find ways that we could address what we hear is lacking compensation for our employees. On the con side, there's no claims data. Richland County would not be able to see what our spend is in specific areas. Currently, we get aggregate data from Cigna, but not individual data. You only get that if you are actually a self-funded program, but we wouldn't actually get our own claims data. We would have to make a 4-year commitment to the program. I can tell you that generally, historically, there's not been significant increases for employers, but we would have to make a 4-year commitment there. And since the enactment of Obamacare, the standard plan has actually not seen rate increases for employees. Employees must meet the deductible prior to a copay for office visits. But again, the county is looking at a way that we might be able to address that so that employees might not feel that pain. Non-embedded pharmacy deductibles. as I had pointed out earlier, that means that your pharmacy does have a out-of-pocket maximum in addition to your major medical. And then potential changes to retiree dependent costs for those with less than 100% premium coverage. There are some other administrative issues, but most of those would not be seen at all by the employee. So I haven't gone through those, but they are included in all of the information that's on our intranet. And with that, we'll go to the next slide. And I will turn it over to County Administrator Brown.
So good morning to everyone. We certainly appreciate you taking time out of your very busy day to spend time sharing with us some of your thoughts and input related to some of this information that you've heard from before today, but then also that some of you may have heard for the first time today. As ACA Thomas stated, this process, and that's what it is, it's a process where I've asked to gather input from all community partners related to this particular initiative related to healthcare. So that includes retirees, both active and those who are not in an active status working with Richland County, as well as employees. So your voice is important to me. I do want to emphasize, I've certainly heard a couple of rumors out there. So I want to emphasize that no decisions have been made. This item has not come in the form of a recommendation. There's been no recommendation drafted. Because I have not received all of the input and considerations that I want to before addressing this matter with council. And I certainly expect that when I speak with council that it'll be in the form of work sessions and there'll be multiple conversations before we ever get down the road to any decisions related to healthcare. The challenge that I'm looking at as the county administrator is both how to effectively retain employees at Richland County who have a request for benefits, but also a request for increased pay, and how to keep the same pot of funds utilized to address that without affecting any increases to the taxpaying citizens. So again, thank you for your commitment to participating in this process and really looking forward to hearing your feedback and your input, whether that's through conversation on today or emails through the HR link that you will see later. But again, thank you and really hope that you will help us by providing feedback and input. With that being said, I'll turn it over to Human Resources.
All right. Our first question is from Mr. Mick. You have been unmuted and are allowed to ask a question or make your statement.
Lauren, he probably needs to unmute on his device as well.
He will.
I was asking when the target date is for putting a new plan into effect.
Thank you, sir. It's a very good question. There is no specific target date. I spoke with Human Resources last year about beginning to take a look at this because we know that based off the information that we were seeing, that there was going to likely be some potential increases to cost for healthcare. And we wanted to try to get in front of any changes that we would have to make to the plan, to the premiums, or to any plan changes. So there's no target date, but we certainly want to be looking at all of our options as we consider the future healthcare costs. Right now, we don't have the details from our current provider as to what they look like for charges for next year or what they're asking us to do. But in anticipation of this, just healthcare in general, we've been looking at this over time. So there's no target date, sir.
Okay, my second question will probably be something if somebody could get back to me via email, because I doubt if it's going to be at the fingertips, is what is the MLR for employees versus employee with spouse versus employee with the entire family? And if that's not readily available, somebody could email it to me. My question is because I'm wondering if there is a substantial difference in those groupings, whether costs assigned to the employees are going to be associated with those MLR figures.
This is Dwight Hannah. I do not have the specific numbers at my fingertips, but offhand, off the top of my head, I can tell you that on the average, spouses cost more than employees on the average. And also as it relates to retirees that are on the Cigna plan, they cost more than our employees. Now, some of that is just the, I guess, the general nature of those of us like me who are fortunate to be a little bit older. We tend to have more healthcare costs, but that is the general tier. But yes, we have those numbers. We do look at that very carefully, and as those I guess percentages change over the years, we've tried to not exactly align it, but have it where it's correlating with those MLRs. But we can get you the exact percentages. Thank you.
Okay, thank you. And that's my only other question.
Would you all mind, for those who may be on the call who not familiar with those acronyms, to communicate what that stands for those individuals who may be interested in what's being asked and requested?
Sure. Thank you for that question, Mr. Brown. We certainly don't want to get hung up on HR lingo and stuff like that. MLR stands for medical loss ratio, and that's basically taking a math equation of what you pay in claims and comparing it to what we pay the insurance company in premiums. So for example, if we paid Cigna $100 in claims and we paid them $100 in premiums, we'd be at 100% MLR. To use a simplistic example, if we paid $80 in claims and paid them $100 in premiums, we'd be at 80%. So thank you for that, Mr. Brown.
Thank you.
All right, our next question is from Zoom user. Zoom user, you're able to speak or ask your question.
So this is James White. I think it kind of tails into what the previous question was. If we go to PIBA, what is going to be the change regarding? Is it going to be more for a child, a dependent, or is it going to kind of remain the same, or be less, or how are we going to be affected? With the child on our insurance.
So the answer to that question is if you looked at, or you were able to view the chart that was on the screen, in general, in terms of premiums, it showed that the premium cost associated between the plans was less for PIBA, but that was just a premium cost. And we were trying to make sure that we did not indicate that the premium cost is the only thing that should be considered. I would also just say, I know you asked about PIBA specifically, so I hope I answered that question as to that premium rate being less as compared to the current plan in terms of the premium. However, we also wanted to make sure that we did not articulate to you that the premiums going forward with our current plan may not be the same. So it's certainly possible that the premiums that we're currently paying, both as an employer and employee, could go up with the current plan that we're on.
Okay. Thank you for your time.
Thank you.
Okay, our next question is from Mr. Rumfeld. Mr. Rumfeld, you are able to ask your question or make a statement.
Thank you. Thank you for taking time to answer our questions. I have just a quick question. During most of the conversation, they talked about how there might be monies to help out employees with these deductibles or any increases, but what's going to be done for the retirees for any of these increases? A lot of our retirees might be on fixed income. what can be done for that.
You're right, Mr. Rumfeld. That's not something that we have discussed, and thank you for bringing that up. And that's something that we will need to consider is, what way can, these changes that affect the retirees also be somehow considered. I would just tell you just in general, when you're dealing with the health insurance plan, and I know working for county government sometimes is a unique situation. In those instances, a lot of times, those I guess groupings of individuals, while they're treated equally in the process, that there are some unique challenges that comes to addressing, how you would affect them. So one of the things that was talked about was, well, what happens if, for example, a retiree says, this doesn't work for me, and that Richland County can't really make, I guess, payments on behalf of the retiree. Then one of the things that could be done is the retiree could potentially receive the amount of funding that they would normally otherwise have paid, and get those funds from Richland County to then choose a plan of their own choosing. So those are some of the different things that have been, kind of considered. But, again, this is just a process. So if you may have some ideas or thoughts that you may think we can consider that you may be aware of, this would certainly be one of the opportunities that we would love to hear that. And even if it's not just today, you can certainly share additional information. But we don't know all of the opportunities, and we're not limited on anything that we're willing to consider. So please feel free to share.
Okay, thank you.
Thank you.
All right, our next question is from Larry. Larry, you are able to speak and ask your question or make a comment.
If you're speaking, we can't hear you.
Can you hear me now?
Yes, sir.
Okay. In Ms. Thomas's presentation, she indicated that those individuals that are over 65, that there will be a potential increase when she went through the numbers and through the graphs, but she didn't give a specific amount of that estimated increase to those over 65. So does anybody have a number associated with that?
I can try to answer that question. I have an aggregate number there, but that's just the total. It really depends upon the status at retirement, the number of years that you worked, and what your current funding strategy is. Your current funding dynamic is with the county. Of course, if you're at 100% and you're only covering your employee, then you're at 100%. So it would really depend individually upon the employees. So it's very hard to put in that into a presentation. But if somebody would like to call me, they're more than welcome to, and I can tell you what my strategy, what my methodology was.
Thank you.
Thank you.
All right, our next question is from Ms. Hayes. Ms. Hayes, you are able to ask your question or make a comment.
Yes, good morning or good afternoon. When I retired in 2005, I was still on the complete health insurance. Then when I turned 60, I believe, and I became disabled, I was changed over to Humana. Well, when I was under the complete retirement from the county, Medicare paid 80% and Cigna paid 20%. But when I was changed over to Humana, Humana only pays 80%, and then I'm left paying the other 20% because you cannot have another insurance with this Humana plan. Now, my problem is I have autoimmune ailment, and so Humana would pay 80% Now I'm left paying $330 every 6 weeks, which is impossible for me. So can y'all look at some of the plans that Humana has? Or why was I taken off of the Cigna?
I'll answer one of the questions and I'll let the HR team talk about, and I think they mentioned earlier about looking at different plans. So I'll let them speak to that. But in terms of can we consider different options? Yes, ma'am. I think that's something that was tried to be communicated earlier, is that the Human Resources Department tried to consider different plans throughout the course of our coverage. So that is something that is certainly possible for us to do. In terms of plan structure and your movement from one plan to another, I'll let Human Resources speak to the county's process as it associates with retirees at whatever levels, because I don't have those details. So I'll certainly see if Director Hannah would like to respond.
Yes, thank you. I'll respond in general about the plans. I won't speak any about your particular healthcare situation on this call, but we're certainly glad to talk to you personally about that in as much detail as you like. The county currently has, I guess, 2 retiree plans. One is with Cigna, as we talked about, for retirees that are under 65 or they don't have Medicare Part A and Part B. Generally, you have to be 65 or older to be eligible for Medicare Part A and Part B, or if you have a disability that's been approved and you're younger than 65, you still may be eligible for Medicare A and Medicare Part B. The reason the county has a Medicare Advantage plan, it is the same plan that we had same type plan that we had when we were with Blue Cross Blue Shield for many years ago. And I'm thinking it may have been about 7 or 8 years ago when Blue Cross got out of the business, the group Medicare business. We were trying to keep the same plan, same type plan that retirees had to create the least disruption, since we were having to move from Blue Cross to Humana. The way the Medicare Advantage plan works in general, it is inclusive of Medicare. So there's Medicare that's a part of the Medicare Advantage plan. And in addition, the county pays a premium to Humana, which covers more than just Medicare. One of the main benefits of a Medicare Advantage plan, the retiree does not have to deal with both Medicare, like one insurance company, and then whether it's Cigna or Humana or whoever, in terms of trying to coordinate the payment of the 2 systems. So am I saying Medicare Advantage is perfect? Absolutely not. Am I saying Medicare Advantage is the best option for every person? Absolutely not. I'm just explaining one of the primary advantages of Medicare and why we have a Medicare Advantage and why we have a Medicare Advantage plan. So in summary, if you are 65 or older with Medicare Part A and B, and you're eligible for retiree insurance with the county, you're on Humana. If you're less than 65 years or older and you have Medicare Part A and B because of a disability, you're then placed on the Medicare Advantage plan as well. I will stop there. I will see if Ms. Walker wants to add.
I don't have anything additional to add, but I will, much to add. I will just say that regarding claims filed with Humana, the Medicare Advantage plan, Humana will not necessarily, depending on the claim and the services being rendered, cover the entire bill of the remaining part that Medicare does not pay in general. Thank you. Do you have any other questions, Ms. Hayes?
No, ma'am, that's all. It's just that when I was under Medicare and Cigna, I didn't have any financial problems. But now with this Humana, Humana is a bit much. But thank you.
You're welcome. Thank you.
And I think it's important for me to say, as it relates to the county, every insurance company has different type plans. So I don't want it to be like, Humana is bad or Blue Cross is bad or Cigna is bad or something like that. The situation you're describing is the plan the county has purchases with Humana that doesn't pay 100%. I'm not a Humana expert. I don't work for Humana, but I'm sure Humana may have a plan where they cover about everything. Now, that plan would cost a whole lot more if the county purchased a plan that covered everything. So I don't want it to be to seem like Humana is doing something bad. It's the plan that we have purchased from Humana that does not cover everything. And even with our employees, and I know we're talking about retirees, the county's insurance does not cover everything. There's some things employees have to pay depending on the medical service they get. So I just wanted to add that. It's not something wrong with the plan. It is a type plan the county has purchased. Thank you.
I appreciate that. And just one other little thing. The problem I have is that they will not allow you to have a supplement insurance. So that's where I have the problem. But I appreciate y'all time and y'all answers. Thank you.
And her last point is correct. I'm not sure that is a Humana rule or a federal Medicare rule, but I do know if you have a Medicare Advantage product, whether it's with Humana or Blue Cross or Aetna, whoever, it is my understanding that they do not permit you to have a Medicare supplement along with a Medicare Advantage plan. Thank you.
All right, we have a question from Mr. Larry again. Mr. Larry, you are able to ask your question or comment.
Can you all hear me?
We can now, sir.
Okay, all right. Those of us that were on the committee were provided a copy of a study that was done by Gallagher. And whenever this information is presented in the work session or to the council, I'm assuming that they will have the benefit of that study, which was pretty comprehensive as it relates to the pros and cons or the good, bad, and the ugly of Richland County going from potentially going over to PIBA from Cigna. So that's a question.
Yes, sir. And I'm gonna answer your question a little more fuller. So yes, sir, the council will have access to that information. And in addition to the council, all employees and all retirees will have the same equal access. I believe there is, I know that there is currently information that has already been provided via electronic means. And I believe that same information will be provided through electronic means to you all as well. But I'll certainly allow Director Hannah, who's come on, to clarify. But I will tell you as a county administrator, yes, sir, we expect to provide that information to county council with all other information for their consideration whenever that happens.
Okay, thank you.
Mr. Brown and Mr. Smith, all the information from the 7 impact committee meetings is already available on our internet site. It was provided to the members of the impact committee. In addition, all the presentations are available and were provided to the impact committee. The meetings were recorded. All the recordings are available as well. In addition, some questions, comments, input came up, and we took notes from all those meetings. All those notes were provided to the impact committee, and all those notes are also available. Some of the questions from the meetings related to maybe, for example, Charlotte, City of Charlotte or Mecklenburg. I think someone mentioned that their brother or brother-in-law retired from there and they had a plan. We contacted them. We got that information. So there's even information beyond what was covered in the presentations, but certainly everything that was covered in the presentation was provided to the impact committee and is available on our intranet. And there is a link to that. And if anyone has any trouble navigating, getting to that, they could just email either me or Ms. Walker. We'd be glad to email it to them as well. Thank you.
Are there any more questions, comments? Yes, Ms. Wanda Kelly, you are able to speak and ask your question.
Good afternoon or good morning. My question is, as a retiree, how can I access that information since I don't have access to the intranet?
I'll let Ms. Walker help me with that.
Thank you.
Yes, ma'am. The information, the same information that is provided to employees via our intranet is also provided to retirees through this link. If you look at the screen at this time, there's a link. And I think in our email, we also included this link, but we will definitely be sending this out as a closeout for these town hall meetings that will include this link. And this link will take you to the site that has all that information that Mr. Hannah was speaking of as well.
Thank you.
You're welcome.
I have one other question.
Yes.
What is the...
Hello to one. How are you doing?
Hey, Dwight, I'm fine. How are you?
Good. I'm not doing as good as a retiree, but I'm doing okay.
I agree. My question is, what is the calendar year plan for PIBA?
The calendar year, unless they've changed it when we looked at it last year, they operate on a calendar year, January through December. And I know Ms. Thomas has been a lot more vertical with that than I have, but if she can let me know if I'm off base on that or it's been changed.
No, Director Hannah, you're correct. Thank you.
All right. Thank you. That's all I have.
Thank you very much. We have another question or comment from M. Smith. M. Smith, you are allowed to ask your question or make a comment.
Wanted to make a comment to say how much I appreciate Trina Walker's help. She's been excellent every time we call. So shout out to Trina.
All right. Congratulations on the shout out, Trina.
Thank you. Thank you, Ms. Smith.
You're welcome.
Thank you, Ms. Smith, for that acknowledgement. We appreciate that.
You're welcome.
All right. Are there any more questions? All right. If not, we want to thank you all for your input, questions, and comments.
Additionally, if you all have any additional questions, please feel free to email us at our benefits email address, and we'll be sure to address those questions and comments. And enjoy the rest of your Friday and weekend.